guys, welcome back to my channel. I know it's been a while, but today I am back with a new video on my experience as a physician assistant student on placement in accident and emergency. I know you've all been waiting for this reflection, so you know what, let's jump in. So first of all, I want to make a quick disclaimer. This might not be the experience that you might get when you go into the course, even if you were to go into my university. So I just want to put that out there. But again, overall, I absolutely enjoyed my experience in accident and emergency, or ED, whatever way you want to call it. I absolutely enjoyed it, and I think the reason why I enjoyed it was because it was literally my niche. It was my cup of tea, and when I say this is because I am someone, as you might have seen from my personality, I like different things, and I think with A&E, I like the fact that you could see different things, especially in acute stages, which was really good. So now, when it came to my placement in emergency department, I was extremely lucky to be in a trust where they had already 6 PAs, guys, 6 employed PAs working in ED. Mind-blowing because this was actually my first ever specialty where I have encountered a PA. And to be honest, it was one of the reasons why I wanted to particularly go to that trust, because I felt like I needed to see truly where the boundaries between a doctor and a PA was. And in ED, I was able to see how valuable physician associates actually are. So when it came to my day-to-day, actually, I have to say that I was there with some other students from my cohort. I think we're about, from the top of my head, we're 6 of us. And what they had done was to stagger the time we came in order not to have everyone come in at the same time. So we had weekly rotation of doing 10-hour shifts. So if I started at 8, I would finish at 4, and then someone else, a set of PAs will start at 10, finish at 6, and another set would, is that correct? And then another set will start at 12, finish at 8. And the whole point was in order for us to not be together all at the same time, and to ensure that we maximize the experience across all of us. However, of course, I'm always different. I ended up doing 12-hour shift just because I really liked it, and I wanted to make sure that I took on all the opportunities I could get. And trust me, I got that. And that was, I think that was the most rewarding part, was the fact that I felt like I had seen so much, and that could, of course, help me aid the choice of what specialty I might want to do next. So when it came to my day-to-day activity, every day wasn't the same, and I can tell you that for a fact. You might see the same presentation, however, there are different ways of managing it, possibly. And the reason why I say that is because when you go to ED, I feel like you really and truly need to have an open mind, and at the same time, think obvious is obvious sometimes, okay? So I would start my day at 8 o'clock most of the times, and I preferred it because I just wanted to be there nice and early, because my commute was quite long. So I did make sort of an advance, asking the consultant to switch my timetable to reflect the fact that I wanted to do 12 hours, and I love the fact that they were happy with me doing that. So usually I'll do an 8 to 8:30 shift and have half an hour to 45 minutes break, mid-time with my peers, and I would come in for 8 o'clock. We'll then have sort of a board round whereby it's called handover, and in the handover, the night staff, key members of the night staff, will come upstairs where we gathered, and we would talk about anything that needed to be handed over to the day staff, which of course I was part of, and then from there, we'll get allocated to different sections. Now, the hospital where I was had different sections, such as majors, resource area, and a place called Area 3, which was basically minor unit that dealt with minor injuries and minor illnesses. So as I said, every day was not the same, and there was also a COVID bit as well. And I think and also there was rapid assessment unit. So there were 5 areas in total. The good thing is I got to work in all of 5 areas because I was very proactive, and that's one thing I definitely want to tell you. Be proactive when you're on placement, because you how would I say, if you are proactive and you show that you're keen to learn, number one, you create opportunities for yourself, but number two, you can get your stuff signed easily, because we had stuff to be signed off. And when I mean stuff, I basically mean CBDs, mini cakes and DOPs. Uh, so again, after handing over, what will happen is I would go to my allocated area, and literally we'll get patient to clock. We'll clock the patient, and then usually they try to pair us up with the PAs, but of course that was not always the case. So you would have an allocated doctor to always refer to, and also the employed PAs would have to always consult the consultant to discuss their management plan. So we basically did the same thing. We would clock the patient, take them into consultation room, always disclose that you were a student, and if they were happy for you to clock them, you would do so, write their notes, and ideally what they wanted us to achieve was to ensure that we did come up with differential diagnosis and how we would manage the patient. And managing the patient, we might want to request a chest x-ray, an ultrasound, blood test, and things like that. Once we've discussed that, we then proceed to carry out any jobs that we needed to do. So for example, if we had recommended that we needed some bloods done, ideally a nurse would have done the bloods. However, I always wanted to do the bloods for my patient, as I felt that it would be necessary for me to ensure that I am becoming good at that skill, if that makes sense. Guys, I can tell you for a fact that taking bloods was one of the hardest things ever for me to do, but since I have had that experience, it's become more and more easy for me to do so. So also cannulas, I got to practice lots of cannulas, not so much arterial blood gases, if I'm very honest. I did it once in ED, but yeah, other than that, again, my clocking experience got more and more better, because I was able to literally clock as many patients as I really wanted to and that were available for me to clock. And although there was COVID, I really did not feel like that took away from my experience in ED. I love the fact that the whole team was pro PAs, meaning that it made our life easier, because they had trust in us, which is very important. When you go into a specialty or a team where they don't really know what to do with you, you might actually really struggle. And in my case, that wasn't the case. Yeah, I really did enjoy my my days in ED. Also, I was able to do lots of clinical skills, as I mentioned, one of them being suturing. Oh my god, I loved suturing, and it was nice that they trusted me enough to do the suture. And yeah, it was something I got signed off as well. Another thing that I got to do was to basically discuss like CT investigation with their duty radiologist. So if you're not aware, in my trust, any CT you request, you would have to discuss it with the radiologist due to the implications that they might have. So it's always I think that is a skill, is a way for you to practice your bar as well, your S bar, or whatever you want to call it. And I think having that opportunity to do so has helped my communication skills in return. One thing I can definitely say is in ED, I found myself really being proactive and seeking opportunities. I attended trauma calls in recess. I saw lots of referrals being made to different specialties, because not everyone would receive treatment on that day and be discharged. Some people unfortunately would needed to be admitted, and in order for that admission to happen, you would have to refer them, because again, A&E is a transition bit. You know, the whole point of A&E is to treat the emergency. However, if they need to be admitted, you have to refer to the specialties such as orthopedic team, medicine, surgeons, and things like that. So eventually I got to practice a lot of my SBA as well in ED. And I think really my whole experience was quite positive. In regards to cons, I found really challenging the fact that yes, for example, we can't sign X-ray. Of course, as a student, I don't think, of course, as a student, I understand that we can't at all. But also, I felt like the fact that also the PAs that were working there, due to lack of regulation, you can't sign X, and even like sign for, like, for example, if a patient needed fluids, or you can't sign that, or any sort of medication. I think that was a bit frustrating, because it does take away from the time that you're using to manage that patient. But other than that, I think that's the only downfall, which does not really apply to me. But because I'm already thinking about the areas I would like to work into, I found that this is going to be a big challenge as well. I can't think of any other cons, if I'm very honest, and that's because the people I worked with were absolutely amazing. Helen, I don't know if you're seeing this, but I just want to say massive shout out. Helen is a PA I really did tag along with. You know, when you just meet some people and you really just make that connection? I literally made that connection, and she would call me every time if I wanted to see something, if I wanted to do an ECG. Literally, she would make sure I got the most out of the day if she was in. And Helen, if you're watching this again, I am so grateful, because you did an amazing job and you made my experience even more exclusive, if I must say. And again, one thing I would advise you, of course, you're not recommended to stay longer than your scheduled hours. However, if you do feel like you need more, do stay longer, or do ask to come back, because most of the time for you to come back. So I'll definitely recommend that you do ask to come back if you wish to. Other than that, I definitely say when you're in ED, you do need lots of resilience and patience. Again, you're seeing a new patient every time, and because of that, it can be quite exhausting. So do not take more than you can handle. That's what I'll definitely say. There are some days, in a good day, I would see about 4, 5 patients, even 6. Sometimes I would only see 3. But you know what? It's okay. It's heavy, you know, as a student. However, I felt like the people around me worked and with me and knew what I needed to know, if you get what I mean. Knew my goals, knew what my requirements were. And again, it's always good to tell whoever is working with you, this is what I can do and this is what I can't do as a student. So of course, if you're unsure of anything, always say, you know, I'm not sure, you need to help me out. However, what I would definitely recommend is that if you find someone that you do get along with, please tag along with them, because they will show you the way. And that is what I did with Helen, and I absolutely enjoyed my experience. If you have any further question about my ED experience that I did not cover in this video, please drop your questions down below, or comment if you've had a similar experience to mine. And yeah, guys, I think I'll see you in the next one. Like and share, subscribe to my channel. Thank you so much for the amazing people who are following me and who have used also my service, PA Glam by Stefania. I love you so much, and bye bye.